Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Biome edition. This audio podcast as part of a Labostix Vortex. This audio podcast as part of a Phantom newscast. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production. In this audio podcast, or as part of this audio podcast, looking at Abstrax now from around 2022, and as part of an abstract for the American Society of Nephrology, and looking at an abstract in regard to educational support surrounding chronic kidney disease (CKD), a qualitative inquiry. So, an estimated 15 million recipients or patients in the United Kingdom or in England have at least one long-term condition or long-standing condition, with the prevalence of chronic kidney disease (CKD) increasing or rising. Understanding educational support can help navigate between health sectors. In amongst this, as part of this works, one of the main aspects was where this was a UK investigation which sought to understand educational support surrounding chronic kidney disease. In amongst this works, as part of this works and this works in this sort of abstract, the research was approved by a northwest sorry a north yeah a north a northwest sorry a northwest a research ethics and organizing committee, and where the ethics approval had been linked to a particular sort of ID, a particular ID or project ID. In regard to the methodology, the research used or utilized qualitative methodology and an inductive content analysis ICA approach, which is particularly effective in linking theory or framework. And amongst this, as part of this research and this works from 2022, there was an aspect in regard to patient and public involvement, or PPI, where two workshops took place in May and June 2019, and wherein topic tagging activities were co-developed between two social media platforms, the Renal Patient Support Group and the Kidney Disease and Renal Support Groups, KDAR's Group for Kids social media platforms. In regard to the sampling and recruitment aspects of this works, 19 participants between 4 cohorts that included 6 general practitioners, 4 healthcare scientists, 3 nephrologists or clinicians, and 6 CKD, 6 chronic kidney disease recipients were recruited and participated in one-to-one telephone interviews. In regards to the sort of data collection, topic guides were sort of developed for participant cohorts with several themes to collect data through one-to-one telephone interviews. In regard to the analysis, software was utilized to provide opportunity which provided opportunity to code and glean insight to develop overall conclusions. In regard to the sort of results, there were nine main themes, and several sub themes were identified when coding for healthcare professionals, and nine main themes and several sub themes were identified when coding qualitative data for CKD chronic kidney disease recipients. In regards to the conclusions, sort of part of the conclusions, there needs to be a coordinated effort between healthcare service users and healthcare professionals or healthcare providers to understand how CKD education should be more integrated at point of care and in line with public health. Additionally, to inform that main sort of terminologies in regards to this works include nephrology, education, qualitative research, and patient and public involvement. When looking to identify literature listeners out there on listeners in regards to this works, putting in certain terminologies, certain terminologies in databases will and should allow sort of a retrieval of similar publications and works that sort of that are and would have been similar to this works, or as part of the abstracts the abstract aspects of this audio podcast and the research. That draws this audio podcast to a close. This audio podcast is part of a Biome edition. This audio podcast as part of a Labostix Vortex. This audio podcast as part of a Phantom newscast. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production.